Hello, I am Chola Nagandi, an oncology social worker at the Sidney Kimmel Cancer Center at Johns Hopkins, and a member of the Harry J. Duffy Patient Family Services Program staff. On behalf of the Kimmel Cancer Center at Johns Hopkins, I am pleased to welcome you to our 8th annual Cancer Survivorship Conference. Session 2, Moving and Stretching for Everyone. We have an exciting series of workshops planned for you. They will be held each Thursday in October from noon to 12:45. These events are offered through the generosity of the Harry J. Duffy family, for which we thank them. Some details about this virtual workshop. You may offer a question or comment through the question and answer button. Although, given we are over 150 people in attendance, we may not be able to specifically answer each question. However, knowing our speakers, I am confident that they will try to answer the questions the best they can. Please help me in welcoming Johanna Taylor, Liz Houghtaling, and Annie DiOrio, 3 of our amazing Johns Hopkins physical therapists. Johanna has been a PT for almost 2 years after graduating from the University of Delaware. She's been at Hopkins since graduating and has most of her experience working with our surgical and oncology patients and families. She's excited about mobility in the oncology population to maximize the functional independence and increase their quality of life. Liz has been a PT for 8 years after graduating from the University of Miami doctorate in physical therapy program and has been at Hopkins now for almost 2 years. She is passionate about working with our oncology patient population, which has been her focus since she started at Hopkins. Annie has been a physical therapist for 5 years after graduating from the Franklin Peace University of Manchester in New Hampshire. She has been at Hopkins for the past 4 years, primarily working with our oncology patients and families. Thank you, Johanna, Liz, and Annie, for sharing your time with us today and helping us move and stretch.
Okay. Hello, everyone. My name is Liz Houghtaling.
I'm Johanna. And I'm Annie.
And thank you all so much for tuning into our workshop, Moving and Stretching for Everyone. We're excited to share a little bit of what we do every single day with our patients. First, we'd like to do a little introduction on exercising specifically with the oncology population, then go into a dynamic warm-up, and go into some arm and leg exercises that you can do in the comfort of your own home with various familiar objects that we have here on the left that we'll go over soon. At the end, if there's time, we'll go over some stretches as a cool down. If you're interested, there is an attachment to the Zoom link where you can find a little bit more information as a cancer resource, cancer rehab resource. So first, why is it important for the oncology population to exercise? So from a medical end, exercise helps to improve your aerobic endurance, improve your flexibility, improve your muscle strength, improve your balance, improve your blood sugar, improve your bowel and bladder function, and improve your bone and joint health by increasing and maintaining your bone mass. But also importantly, from a quality of life aspect, exercising can improve your sleep quality, reduce nausea, improve your social well-being, especially if you're doing exercise classes as you are today or outside. It can improve your fatigue, which we'll go over soon, and can also improve your mental health by increasing endorphins. So more importantly, exercise can help with the late effects of cancer treatment, including pain, fatigue, weakness, joint stiffness, difficulty with balance, possibly from some neuropathy that you're having in your feet, lymphedema, and just overall decreased endurance. So along these lines is one of the most important effects of exercise, which is to combat cancer-related fatigue. And I'm sure some of you are nodding your heads right now. It is the most common complaint following a cancer diagnosis. And unlike normal fatigue, it does not recover with increased rest time. Exercise, however, has been proven in multiple research studies to help combat this fatigue and actually reduce your fatigue over time. So this is why it's important to pace yourself and participate in activities to prevent deconditioning despite feeling a little bit fatigued.
Great. So currently, the recommendations for exercise for cancer survivors are 2.5 hours of moderate intensity exercise a week or 1 hour and 15 minutes of vigorous exercise a week. It is important to discuss with your doctor and know your limitations. Some precautions with participating in exercise are generally, if it feels painful, stop performing. And keep in mind your precautions from previous surgeries or treatments. So if you have a PICC line, remember to avoid overhead activities. If you have known bone metastases, avoid resistive exercises and be cautious with weight bearing. If you have balance deficits or are at all a risk for falls, use the modifications we will show you today.
Okay, and so with that, we are ready to start with our exercise program today. I want everybody in preparation for our exercises to make sure that you have a chair, either for sitting in to perform the exercises. We will also be showing you standing variations of the exercises as well. We recommend that the seat also has a back to it and also no wheels so that you can hold on and not slide away. Also in terms of making sure that you have other household items with you too. So if you have weights or if you have bands at home that you would like to incorporate into our exercises for resistance, you can grab those and put those near your chair. We also have some household items that we have that you most likely have that you can use in the place of weights. We have things like a flashlight or soup cans. If you want to try a little bit of a heavier weight, you can also try to grab like a gallon of milk or something like that. That's about 8 pounds. We also have a belt that we're going to use for some stretching later on. And then we also have a pillow as well that we will use for some of the exercises. So at this time, if you have any of those things, you're going to want to go and grab them for the exercises. So with that, we're pretty much ready to get started. It's really important anytime that you start exercising to make sure that you go through a warm-up first. Warming up is really important because it helps to prevent injury. It also helps to start getting your circulation going. It will also help with starting your heart rate and help your muscles to engage in the exercises as well. So with that, we're going to start off today with 3 rounds of diaphragmatic breathing. With the diaphragmatic breathing, basically this is just deep breathing. So what I want everybody to do is we're going to have you put your hands on your belly. I want you to take deep breaths into your belly. You're going to feel your stomach expand out, hold at the top, and then breathe out through your mouth. So deep breath in through your nose. 1, 2, 3, hold at the top, and then breathe out through your mouth. 1, 2, 3. We're going to do that 2 more times. Breathe in deep, hold, and then breathe out. 1 more time, breathe in. Good, hold at the top, and then breathe out. 2, 3, very good. At any time during the exercise program today, if there's an exercise that either is giving you pain or you feel like you need a little break, feel free to not participate in that exercise and just go through a round of breathing. It's a really great way to recover and then jump in whenever you feel ready to start exercising again. With that, we're also going to start our stretching. To begin warming up, we have 5 stretches we're going to go through. The first one is our upper trap stretch. So we're going to start by stretching out the right side of our neck. So go ahead and take a seat on your right hand if you can. We're going to bring our left hand overhead and we're going to stretch towards our right side and just hold it. You want to make sure that you're not yanking your neck over. Just do a gentle stretch. Good, hold, and then relax. Very good. We're going to do 5 more, or 4 more, I should say, on this side for a total of 5. And then we'll switch sides. Good. And for a lot of the stretches, you can hold from anywhere from like 10 to 30 seconds, whatever feels comfortable. We're doing more like 10 seconds today just for timing purposes, but it's a great way to kind of get your muscles warmed up and ready to go. Again, if you're having any pain with this, you can go back to just the diaphragmatic breathing or just try not to go over as far. So just decrease the range of motion that you're going through. Okay, perfect. And now we're going to switch sides. So now take a seat on your left hand here. We'll bring our right hand overhead and we're just going to stretch to the side. Good. Awesome. And again, if it hurts to go over too far, you can just go over not as much. Just make sure it's nice, gentle stretching. You should definitely be feeling it on this side of your neck here. Here we go. Sitting on your hand also helps to kind of bring that left shoulder down to intensify the stretch. If that doesn't feel good, you can always just put that left hand in your lap instead of sitting on it. Okay, perfect. And I think we have one more to go here. I'm talking so much I'm losing count. Okay, perfect. All right, next we're gonna do some neck circles. So we're gonna start by doing neck circles clockwise. We're gonna do 5 of them clockwise and 5 counterclockwise. So you're just gonna put your head down and we're gonna swivel around. Again, this should feel nice and relaxing and good. If it doesn't, feel free to just do that breathing that we were just doing in the beginning, or even doing a couple more of those trap stretches if those felt good to you. Good, that was our 5th one. So now we're gonna go counterclockwise. Good. Nice. All right, good, we got 2 more here. And then we're done with this one. Okay, good. All right, the next one is gonna be some shoulder shrugs. What we're gonna do is you can just put your hands down kind of in front of you here. We're gonna shrug our shoulders up towards our ears like this, and then go ahead and relax them away from our body and go down like that. We're gonna do about 10 of these. So when you press down, it's almost like you're tucking like your shoulder blades into your pockets. You wanna kind of push your shoulder blades away from your head towards your bottom, and that will kind of help to really stretch out your shoulder blade muscles or your scapular muscles. Okay, good. This exercise too, we're not really adding in any hold times today for the sake of time, but if you're doing this on your own, this is one that you want to kind of keep in your exercise repertoire, you can always add hold times in. And that can also feel really good and also be a great way to stretch out these muscles. So I think this is 6. Good. Nice. Good. 2 more. Good, and last one. Awesome. The next one is also going to be kind of a scapular release, stretching our pecs here and kind of using our scapular muscles. What we're going to do is I kind of like to bring my arms up for this exercise, and then what you're going to do is you're going to kind of puff your chest out and squeeze your shoulder blades together, hold for a couple seconds and relax, and come out like this. Good. Some things you want to be careful of to avoid when doing this exercise so that you're not cheating. You don't want to have your shoulders up near your ears. You don't want to be arching your back too much like this. You want to really be using those scapular muscles behind you, okay? So this is 4. Good. This is another one too where you can add hold times in. So we're only holding for a couple seconds today. You can hold up to 10 seconds, 20 seconds, whatever feels good. And this is a great exercise also to work on your posture. Posture is really important. So if you find yourself really doubled over like this one can be a really good one to kind of help get you up straight. I think we have 2 more. I'm sorry guys, I'm terrible at talking at the same time. So Annie and Liz, keep me straight here if I need to. Okay. So the next one we're going to do is arm circles. We're going to do these arm circles clockwise and counterclockwise too. Yeah, we're gonna move our chairs. I have a long wingspan, so I gotta be careful here. So we're gonna hold both arms out to the side. If you wanted to, you could also just do one arm at a time. So we're gonna do clockwise first. Good. We're gonna do 5 of these. That was 3, 4, 5. Good. And then we're gonna go the other way. Good. 2, 3, 4, and 5. Very good. Nice job. Shake it out. We're going to get into the exercises. We are going to be starting with exercises at our toes and working up towards our nose. So your arms and your neck are going to get a little bit of a break here. Liz is going to be showing us these exercises in sitting. So she'll be doing all our sitting variations of the exercises, and then Annie will be showing us our exercises in standing. So the first exercise we're going to do is called heel toe raises. I'm going to first have you direct your attention to Liz. She's going to show you the seated variation of this exercise. She's going to be going up on her toes and then down, back down, having her feet flat on the floor, and then lifting up her heels to go up on her heels, okay? If you turn over and see Annie, Annie's turned sideways for us. She's going to do the same thing, going up on her toes here and then rocking back on her heels to lift her heels up. Both Liz and Annie, if they want to make the exercise a little bit harder, they can add hold times in. So like holding at the top for 3 seconds, coming down, rocking up at the top for 3 seconds. Annie can also remove her arms from the chair so that she can make a little bit more of a balance exercise. So we're going to work through 10 of these. So if you ladies want to get started, we'll go up on our toes, come down, right back on our heels. Good, that's 1. And keep going, perfect. And I'm going to join in the fun here behind the chair and also work with them. So this is 3. Very good. Rock up on the toes. Good. And like I said, we're not really adding in too many hold times right now, but you can feel free to do that on your own. Perfect. So this was 5. Good. I'm going to make this a little bit more challenging for myself and kind of let go here. And this is a way that you can make it more challenging too. Like I said, is taking away the arm support. So now I'm not only working on the strength of my calf muscles, I'm also working on my balance. Good. I think we have 2 more to go here. Up on the toes, good. Back on the heels, and then up on the toes, good. And then back on the heels, perfect. All right, so those were our heel toe raises. Next, we're gonna do our long arc quad exercise. This is just a fancy word for doing basically some kicks in the chair. So what we're gonna do is, if you have like an ankle weight, or if you have like a heavy boot or something you can put on that can add a little bit of weight on your foot here. But basically what we're gonna be doing is you're just gonna be kicking your leg out straight like this. We're gonna add a little bit of a hold time, 2, 3, come down. What we're gonna do is we're gonna alternate legs today. Some people prefer to alternate, some people prefer to do one at a time. I kind of like to alternate because you can give yourself a little bit of a break. A way to make this exercise a little bit harder too, like I said, so you can do the ankle weight, or you could add like a hold time. So we're holding for 3 seconds, but you could even hold up to, 10 seconds or 20 seconds, depending on what you want to do. Okay, so this is number 5 here. Good. And one thing you really want to be careful of with this exercise is you want to make sure that when you come down, you're coming down nice and slow. You want to prevent dropping like this, because then you're not really using that muscle to control the descent of your leg. And then you can kind of start using momentum instead of actually using your muscle. So this is 8 here. And like I said, if these reps ever get to be too much, or if you need a break, feel free to go back to just that diaphragmatic breathing, or even doing a stretch from earlier. One of those felt really good. You really can't go wrong with adding one of those in as a substitute for the exercise. Okay, very good. All right, so that's it for that exercise. The next one we're gonna do is called a hip adduction squeeze exercise. This is a great exercise if you actually have a pillow, to grab a pillow. So Liz has our pillow here. She's gonna put it in between her knees. And what she's gonna do is she's gonna squeeze that pillow together, really using her inner thighs here, holding for 3 seconds and then relaxing. If you don't have a pillow that works well, you can just use your fist. So that's what Annie and I are actually gonna do, is we're gonna use our fist. So we're gonna hold, squeeze, 2, 3, and then go ahead and relax those legs. So that was 1. We're gonna work up to 10 on this exercise as well. Perfect, and relax. And with a lot of these exercises, I probably sound like a broken record, but the way you make it harder is by adding on that hold time. Anytime you're doing an exercise like this, so like this is another one where you can hold for 10, 20 seconds. It'll be a really good workout for your inner legs here, which is really good. So I think we're at 5. Good, and relax. Squeeze, 2, 3, good, and relax. Nice. Good. We have about 3 more here. So the last 2 exercises don't really have a standing variation for those. We'll get into some more standing exercises after we complete the round of this for our people who are up for the standing modifications. And this is our, so Annie is going to be doing our marching for us standing again. Liz is going to be seated, so we'll go to Liz first. You can either have your back supported on the chair if it feels really tiring to sit up, or if you want to make it a little bit harder for yourself, you can scoot forward to the edge of the chair a little bit so that you're using your core a bit more. And then Liz is gonna just be marching up and down with the legs. If it gets really tough to bring your legs up close to your chest, you can just decrease that range of motion and do what we call mini marches to do them kind of small to the ground. Annie over here, she is also gonna be doing our marches. She's gonna be doing them in standing. Perfect. So same for her. If they get to be too hard doing them like this, she can kind of decrease her range of motion a little bit. Similar to her heel raises, she can remove one of her hands or both of her hands, so it's a little bit more of a balance activity. So we're gonna get started now. We're gonna do 10 on each leg. We're gonna alternate again. So there we go. We're gonna do 1, good, 1, perfect, good, nice. And whenever you're doing these exercises, even if you feel comfortable removing your hands from the chair, it's never a bad idea to have a chair nearby, just in case you need to sit. Perfect. Nice. And I think this is going to be 5. Good. So we're about halfway there. If you want to challenge yourself, really try to lift those knees up close to the chest, make them some high knees. If we're getting tired, remember you can always go back to that breathing or decrease your range of motion a little bit to make it easier on yourself. Good. Nice. And 1 more on each side. Okay, great. All right, very good. Take a second, take some deep breaths while I go over the next one. The next exercise is going to be kind of similar to our knee squeeze we were doing before, hip adduction. Now we're going to be doing hip adduction and going out. So what Liz is going to do is she's going to kind of straighten her knee out on the edge of her chair, and she's going to be bringing her leg out and in like that. Beautiful. On this exercise, we're going to do 10 on one side and then 10 on the other because it's just a little bit easier. Annie's going to be doing this in standing. She's going to be kicking out and then coming back in. Nice and slow. Notice how she's not flopping back and forth. She's controlling it all the way through the range of motion. So let's get started, and we're going to go ahead and do 10 of those. Perfect. So out and in. Nice. I'm going to join in here a little bit too. If you're doing this standing, make sure when you're doing it, you're not leaning over to the other side. That's a way that you can compensate. So try to make sure you're standing tall, even if it's just little ones like this. You really want to make sure you're getting at that hip adduction muscle. Okay, perfect. And this is 5. Good. And keep going through. Good. And again, with this exercise, we're not really adding in those hold times or anything, but you can add in hold times. You can bring out that heavy boot again or that ankle weight to make it a little bit harder, okay? Now we're gonna switch sides. So you're gonna do the same thing, but on the other side. So for me, I'm gonna switch to my right. If you were doing your right already, you can go ahead and go to your left side, okay? So let's go ahead and finish this exercise out. Got a nice little hip crack right there. There we go. Increasing my flexibility. There you go. Okay, so that's 4. Good. Nice. And whether you're doing this in sitting or standing, even try to squeeze that core and engage and stand up nice and tall to work on those posture muscles. You can get a lot of things out of this exercise. So that's 7. We're going to 8, 9, good, and 10. Okay. So the next exercise we're going to introduce, take a deep breath after that one. That can be a hard one, especially if you're sitting with your back unsupported or standing. It can definitely get at your posture muscles too. The next exercise, there isn't a great seated variation for that. So what Liz is going to do is she's just going to go into another round of those kicks that we did as our second exercise, going up or down. If you feel like that was easy and you want to challenge yourself with an ankle weight or increase the whole time, feel free to do that. Annie's going to do some lunges. So what she's going to do, I'm going to scoot my chair out of the way a little bit so she has a little bit more room. But she's going to go ahead and step back with her left leg, and she's going to bend that left knee to the floor. Good. And come back up. Good. All right. So we're going to get started. We're going to do 10 of those on each side. Good. So this will be 2. Nice. 3. Again, with the lunges too, you can add in those hold times if you feel like you're able to. And that's something you can definitely do. Or you can try to kind of go a little bit closer to the floor if you're feeling like you're able to. Make sure you're holding on to something sturdy as well. So this is 6. Good. And good. 8. Good. 9. And last one, 10. Very good. We're gonna go ahead and switch up whatever side you were on. I'm gonna join in on this one and go ahead and do that same exercise. So go down, good, and then come back up. Nice. Good. And you'll notice with Annie too, her leg that's forward, she's doing a really good job of not having that knee pass over your toe. That's really important because you want to decrease the stress to the front of whatever knee is forward. So for her, she's helping to not put too much stress on that left knee by keeping it behind her toe. That also helps you to use a little bit more of your quad here too. It makes it a little bit harder. So I think this is 6. Good. Nice. This is always a hard one, even for me. Good. 8. Good. 9. Awesome. Last one, 10. Very good. That's a hard one. So take a deep breath. Pat on the back for that.
Nice job, everybody.
Yeah.
All right. So next we're going to continue working on the strength of our legs by working on one of the most important muscles of our body, and that is our glutes. So you can look at Johanna for any modifications of this exercise. We're going to be doing squats. So Annie's going to be doing the standing exercise, and Johanna's going to be seated. I'll talk Johanna through what we're doing next. So as a modification, instead of doing an air squat like Annie will be doing, she's just going to simply stand up from the chair. You can use armrests if you need to, and then slowly sit back down. So a modification of that to make it a little bit harder would be not using any armrests if you want to, but you can most certainly use the armrest if you feel tired even halfway through. And then Annie will be working on squats from the chair with her arms supported on the back of the chair. And she can increase the depth if she wants to, or she can even just do little mini squats. She's doing a great job at sticking her bottom backwards and not letting her knees go forward. We're really working Annie's quads today with the lunges and the squats. All right, so we're gonna start with 10, okay? So 1, good. 2, good. You might find that the squats go a little bit faster than what Johanna's doing, which is to sit to stand. So, it's okay that you're not necessarily keeping up with the count. Probably 5, here we go. Nice job. And 6, 7, good. 8, squats are amazing to help you with getting up and down from chairs like Johanna's doing, going up and down stairs. Good, 1 more. All right, nice job. So while Annie remains standing, we're next gonna work on another exercise focusing on your glute muscles. So these are called hip extensions or hip sweeps backwards. So you're gonna notice Annie sweeping her hip behind her. We're gonna start with the right leg, sweeping it back and then forward. Now be careful about arching your back. If you're in the standing position, you wanna sweep your leg back as opposed to arching like this, because that can hurt your low back. Now, what Johanna's going to be doing is a motion that you're only going to see a little bit of. It's very subtle, but it's called a glute set. So you're essentially squeezing your bottom cheeks together and then relaxing. You might see kind of a rise in Johanna's hips and then relax. Yep. So we're going to do about 10 of these, okay? And we'll start. Good. 1, 2, 3. Good. 4 and 5, excellent. 6, 7, it's very subtle. 8, good. 9, and 1 more, 10, and we're gonna switch sides. Now, if you wanna continue doing the glute sets, you can, but we're gonna work the other side now for the hip extensions if you're standing. You can also, if your glutes are getting tired, go back into those long arm quads, or you can start doing some marches in the chair, or even just work on your breathing. So we're gonna start with the other side and do 1, good, 2, I'm gonna work my glutes a little bit here too, here, good, 4, 5, 6, you actually might notice the leg that you're standing on is getting a little bit tired as well, because you're actually working the glute muscle, the side glute muscle on that standing hip. So you might start to notice that that becomes a little bit sore as well, which is a good thing. Good, 1 more. And relax, perfect. All right. So the next exercise that we're going to do is a little bit more of a core exercise. So it's called an alternating arm and leg exercise. So with Johanna, she's still going to be seated, but she's going to lift the same arm and the same hip up at the same time, and then come back down. And as you see, Annie's doing it in standing. Yep, we're going to work on the one side first and not alternate. Good. Yep. Good. 3. Good. 4. If you find this exercise to be a really challenging balance exercise, you can bring your chair over to the other side and you can use your left hand on the back of the chair and raise your right side up like Annie is doing. Good. 3 more. 1 and 2 and 3. Engage your core muscles. Good. All right, we're going to switch sides. So let's do the left side here. So you're going to lift left arm and left leg at the same time. Keep your core nice and tight as you're doing this exercise. Yep, you're going to notice that if you kind of pull your belly button in towards your spine, you'll notice that your core is contracting a little bit more. You can make this exercise just a tad harder by lifting your right leg and your left arm. So that's sort of definitely a little bit more of a challenging core exercise. And he's kind of doing an alternating right arm, left leg, as you see. Good. Let's do 5 more. And 4. And 3. Good. And 2. I gotta work on my balance. And 1. Very nice. Okay. So I think next we're going to continue to move on to the upper body for some push-ups against the wall.
Okay, so we're gonna move into our upper body. You're gonna watch Johanna for modifications and Liz for standing exercises. So push-ups against the wall is gonna be our first one. So watch Liz over here by the wall. She's going to place her hands just outside of her shoulder blades, take a step back and lean into the wall. Good. While she's working on those, Johanna's gonna place both hands on her armrest of her chair and simply straighten her elbows to push up. Good. This is a very important exercise as well to help you with your standing and sitting and controlling your descent. I'll let you guys work through 10. Very good. Liz can increase her depth. She could move over to a countertop and perhaps make her angle a little bit greater to get a little bit more tricep activation. Good job. 3 more or so. 1, good. 2 and 3. Good. So on Liz's way back, she's going to grab some household items because what we're going to do is work on our biceps. So as always, to make things more challenging, Liz can stand to use them. Sure. Yep. We've got a soda can.
Would you like the flashlight?
Sure. Flashlight and soup cans. For bicep curls, you're just going to straighten your elbow down by your side and simply bring it back up. Very good. Yeah. There's not a whole lot of variation with this one, just maybe changing your weight or just using no weight if it's too hard. Very good. I'm even a worse counter. So we'll do 3 more and we'll switch sides. Good. All right. Switch it on over. Good. Straighten and bend. 2, 3. Good. All right. Couple more, and then you're going to keep your weight for the next one because we're going to keep moving up your arm and work on our shoulder next. So with your arms down by your side, you're simply going to lift up to shoulder height with or without your weight and slowly bring it back down. This works on the front of our shoulders. If it's too easy, add a weight. If it's too hard, watch Johanna for the modification. She's going to bend her elbows and make the, the range a little bit lower and it's therefore a little bit easier on your joints. Good. Any clue what number we're on?
This is 9.
Oh,
Oh, I was
great.
gonna say 7. Yeah, we were back.
All right, so out by your sides, you're gonna bring both arms out like an airplane, and you're simply gonna lower and lift, again, shoulder height or just beyond. Johanna can make it easier by bending her elbows. Great, like a chicken wing. And Liz could make it harder by adding something heavier, as a half-gallon or a gallon bottle. We were thinking even laundry detergent, if it wasn't, you know, the Sam's Club 10-pounder. Very good. And we'll do 3 more. Sound good? Okay. All right. For our last exercise, you can sit or stand as well. This is going to be what we call a row. So Liz is going to hold on to the back of her chair and bend slightly forward, letting her hand angle with her weight. She's going to bend her elbow and move her arm backwards, great, to simulate rowing. Johanna's going to do something similar in the chair, and she can add her weight or just keep it with the air. Yep. Great job. This is very important to activate these muscles in your mid-back. They're usually very weak, especially if you have bad posture, like most of us these days. All right, switch sides for me. Good. 2, 3. Great. What number, everybody? 6. Great. Okay. 7, 8, 9, 10. So you're using some of those same muscles that we did for a warm-up several minutes ago. So I think we have some time for some cool-down stretches. We'll make them pretty brief just so we have time for some questions. The first one is going to stretch the back of our shoulder. So you're going to take your right arm, pull it across your body, and gently use your left hand to apply pressure. You should feel this in the back of your right shoulder. And we held our stretches for about 10 seconds in the beginning. You could increase it or decrease it. All right, so we'll switch sides. All right, feels good. After all those soup cans. All right, so those muscles that we just worked in our mid-back, we're going to now stretch by clasping both hands in front, rounding your shoulders, tucking your chin until you can feel the stretch in your mid-back. Very nice. And we can actually transition right into the next one where we open our arms and stretch the front of our shoulders right here, pulling backwards for a pec stretch. This feels good. Also good for bad posture. Good. So to stretch your legs, place your right ankle on your left thigh and gently lean forward. This is going to get a muscle in your glute, and you might even feel it a little bit off to the side. Feels very good. Good. And we'll switch. Yeah. Perfect. The last stretch is simply going to be for your hamstrings, which are normally very tight. Liz is going to use a belt to loop around the ball of her foot. And Johanna is just going to show off her flexibility
Or lack thereof.
by straightening her leg, hinging at her hips, and gently leaning forward. You don't want to arch your back too much. You want most of the motion to come from your hips in order to get the back of your hamstring, and you'll feel a little bit in your calf muscles if you pull your toes forward, which Liz can do very well with a belt.
Oh yeah.
And we'll switch. Very good. So this is our last stretch, and this concludes our exercise and stretching portion. We hope you all enjoyed it.
We can take any questions.
All right, so one of the questions that came across a couple of times was whether or not this recording is going to be made available. And yes, we will be sending out the link for the recording as well as posting it on our website so that you can follow along with our wonderful therapists to do your exercises at home. There was a question about whether people should be doing all of these exercises in one session or if they should be breaking it up.
So, yeah, so I think it depends a little bit on your energy level. So, by no means do you necessarily have to do all these exercises every day. Similar to other, any other workout you would do, you can pick a day where you focus on your legs. I think we gave you about like 10 leg exercises. So you could do those in a session. If you feel good later on, you could add in the upper body. I think it's kind of whatever feels good for you. If you're doing all of these exercises in a row and then you find that you're totally exhausted for the rest of the day and you're not able to go about your normal activities or, walk around in your home or you're in bed for the rest of the day because you're so tired, you probably are doing too much. So then you want to scale back a little bit. We went through like 10 reps of each of these exercises. So if you're still feeling pretty good today, you could then, you can do 10 of each exercise and be okay. Then you can maybe add make it a little bit more difficult and then do 2 sets of 10 of each of the exercises and then see how you do. So, obviously too, this took a lot of time. So if you have like an hour to do this, you could do that. If you only have half an hour, 20 minutes, then you could do just a couple of them that you found more challenging or that you liked and enjoyed. I don't know if you guys have anything to add to that.
No, that was great, yeah.
Is there a good place to find modified exercises that people could do at home?
You mean modified exercises, kind of like the chair exercises we just did? The internet is always just such a wonderful place for various resources like that. I know that I've gotten a couple ideas from seated chair exercises from like some seated yoga classes. You can just even Google seated exercises and do that. I believe there's some pictures of the seated exercises in that in that attachment that was sent on the cancer rehab resource. So there's some seated exercises there that you can guide yourself along with. So I don't know if you guys have any other.
I think it's important to just note that any movement is going to be beneficial. So you sitting in a chair and just moving through some range of motion stuff is more beneficial than being in your bed, for example. So just keeping active and using, common sense loosely will help guide you to success.
Yeah, I would say too, if you're having a lot of difficulty with finding an exercise routine that's very helpful or a lot of issues with fatigue, I think we also attach some resources for like outpatient physical therapy. That's a really great resource if you're struggling to go to therapy and have them get you started on an exercise program that you can maintain. You probably won't be there for very long, but doing a couple visits and kind of seeing what you can do, especially if you have some of the precautionary things that Annie was talking about, like some of those bone metastases and things like that, where you really want to be careful and you don't want to overdo it. It might be good to be overseen by a physical therapist to get started and then kind of go from there.
There was a question about how long you should wait till after surgery to do any of the exercises, and I think that we would suggest that you talk with your surgeon or doctor.
Yes.
For restrictions and when you should be participating in a therapy program. So thank you, Johanna, Liz, and Annie, for giving us your time and insights for our survivors, their caregivers, and their friends. We here at the Harry J. Duffy Patient and Family Services Program are here to support and assist you during your treatment. Please contact us if we can be of any service. The contact number is listed up on your screen now. You will also see in our next slide upcoming sessions that we will be holding every Thursday for the rest of the month. So please join us if you're interested in any of our other sessions on survivorship. And then in early November, you will receive a feedback survey to help us plan future events. So we would really appreciate if you could fill that out and send it back to us so that we know how we can best serve you in the future. And as a reminder, our Medicare and Maryland Health Connection open enrollment is starting soon. So please contact us at the Harry J. Duffy Patient Family Services Program if we can provide any additional information or resources to you as you help make your insurance decisions. So thank you so much for joining us today. And as I mentioned, we will be posting this recording both on our website as well as sending out the link when we have it available. Thank you so much.